Yes, my dear participants, and look at here carefully. It's very important part according to me. Yes, our client is a woman and she's 40 years old after the post-COVID. And we take the biosponges post-auricular area and we prepare into the device now with together. Okay? Yes. This is the anesthetic with only lidocaine we told before, as you know. It's okay? Yes. This is the alcohol sponge, not any bodycon unit. We take her history before. She haven't any systemic disease for like autoimmune disease, maybe autoimmune problems, or maybe diabetes, like this. Okay. We'll take first of all we'll take out on the hair follicles a little, cut off them, and this area is enough for me, as you know, as you see. Yeah. And now I injected the anesthesia, local anesthesia, lidocaine, only lidocaine, not adrenaline. I don't need. We'll wait 5 minutes.
Does the adrenaline affect on the result? Because it can help to decrease
for the decrease of the blessing, maybe you can choose. And in this special equipment, this is the part of the pieces, so it includes a little micro knife. You can see. I only put it and turn over. It's enough. Then I will take out the punches. Okay? One of pieces here. And the last pieces. It's enough. You can put here cold pack maybe for maybe 10 minutes. It can be enough, okay? And you can compress it. And now, this is the hair follicles pieces on the sponge. I will put it, it's a special kit now. This is dirt. This is the one usable kits. You can see it is micro knives in the side. You need maximum 2.2 ml, 2.2 ml saline, or you can also put it and top of it with the PRP.
Biraz çekerseniz fazla olur.
Yeter mi?
Biraz daha çekince. Tamam.
This must be the same. You can see. It's very important. And we choose the kit now. Look at here carefully, please.
İşlem türünü seçin.
And here,
Program seçin.
GCell here.
İşlem başladı.
And start. You here. I can understand. Yes, normal saline, maybe PRP. You can choose anyone. Okay. You need 4 minutes for this step, and after we will take a solution and put it as homogenization kit. As you know, I told before in the presentation, then we will change the part of the side and we will program the other side. Okay? Yes. And totally, this treatment is maximum 1 hour. You finished. You must hold your clients after the treatment, and don't washing up, and maybe don't forbidden for the swimming pool, forbidden for the sunrise, maybe forbidden do a lot exercise. Maybe you can prefer this, and also you can prefer your clients and prophylactic antibiotics for the pain. Maybe you can prefer some drugs, but it's important that if your client uses anticoagulant drugs, it can be harmful. Then you know it's very important. Maybe then after then you can be stir, okay, with the absorbable stirs. It's comfortable. Then we told before you can treat at the same time and finish the treatment.
Can we put dotastride, finasteride with stem cells?
I can
For
understand.
androgenic alopecia?
Yes.
Can we put also dotastride or finasteride mesotherapy?
Yes. Not as the same time.
Not as the
No, I can't prefer as the same time. It can be harmful because, as you know, we told about the complications. It can be rarely, but we can see the side effects. It stimulates the immune system. So if we see any problems, what is the problem because of that? How can you choose what is the problem? So I prefer you then, in my clinic practice experience, you can take your clients after 1 week, 10 day for the PRP treatments, maybe 2 sessions, as you know, we talk about them. It's enough. I support these treatments for especially AGA with PRP sessions, for 2 PRP sessions, okay? It is already will be finished. Yes, we emphasize that, and homogenization and activation is the most important steps for this preparation. Okay, don't forget this because of, as you know, it's inactivated cells and it must be
İşlem tamamlandı.
reproduced. Yes. Now, look at here carefully. You can see its color. It's now ready for homogenization. This is our homogenization kit. We inject it. And we completed it 5 ml with, as your choice, PRP or saline. You need only 3 ml more. That's it. This is its own kit.
The other side, huh?
Yes, and the other partition, look at here carefully. This part,
İşlem türünü seçin.
this is homogenization.
Program seçin.
We change the program
İşlem
and select it
başladı.
and start.
How long would it take? How many minutes now?
Only half an hour minutes. This is the short time. And then we select and the last step, and this is the photo activation, as you know.
İşlem tamamlandı.
Finished?
İşlem türünü
And the
seçin.
last part,
Program seçin.
photo activation.
İşlem başladı.
Start. We need only 10 minutes. Now you can sit down and we talk about the treatment's details. Now we can discuss the others, maybe. You have any question about this treatment, we talk about the others. And when we wait and the solution, I want to talk about and the adipose tissue. As you know, you see I share with the video, you take an selective and special area on the abdomen or maybe on the arm, maybe leg, okay? You can choose a comfortable area for you and you inject local anesthetic with the tumescent solution, you know. It's a special solution with the saline and dextrose and lidocaine with the epinephrine. Now, we inject here maybe 40, maybe 50 ml totally. Then after that, you take, it's the manual system, as you know. It's mini liposuction. And the last, you put it on the lower lock, Sharon, and special cannula, you insert a little punch and drop it. Then you will take and harvested an adipose tissue. You need, for its special kit, you need minimum 10 ml, don't forget please. It's the optimized with 12 ml according to me. So its programs is the difference. I can show you after it's finished, its programs, okay? So you will prepare it. You also need photo activation step. You also need the other steps. Then your special solution, when prepared, you inject at the same time. It's very important rule that you don't wait anymore. You don't send it any laboratory. My dear ecologist told me in the break, he told me I sent before my stem cells to laboratory. It's true? Yes. But he told us now it doesn't need anymore. I can do it in the clinic practice in my own office. Yeah. So you can be sure that our assistants help you whatever you want, whenever you want. It's very important step according to me, because when I start before these treatments, I'm anxious and excited and calling and what is it? What about it? It's enough, like this. So this device is the comfortable, most comfortable than the others, according to me. I see a lot of them, but it's the most comfortable than the others. Have any question about these treatments now?
This filtration solution, you said it's dextrose? You put dextrose?
For tumescent solutions, for the abdomen.
For the abdomen?
For abdomen, yes.
Dextrose, not normal saline.
And dextrose and salina. Not only saline, not only dextrose, combined, okay? And also, it's important that you must use this tumescent solution and lidocaine with the epinephrine, okay? Product, not at all.
You prepare it by yourself or it come ready and you just...
It's come ready, but I can, I'm preparing in my office, yes. It's very easy, as you know. And this is the last step for preparing. Then we will take the solution and inject like the mesotherapy. Then it's almost finished, okay? if you wanna, maybe your clients feel a lot of pain, you can use topical anesthetics. It's possible. Maybe you can use cold sprays, as you know. Maybe. I don't need anyone. I maybe treat here with the cold pack before the treatment, and after that I inject. It needs maximum 10 minutes, as you know. It is the optimized time, and for photoactivation is 10 minutes. You don't ask me, doctor, and why it is not 5 minutes, it is 10 minutes. Because it is optimized time is for photoactivation is 10 minutes. Because of the clinic trials, okay?
İşlem tamamlandı.
Yes, it is finished now. Evet. You can see. Aldı hepsini.
Evet hocam. Fazla aktaralım. Takın onu. Kitliye aktaralım. Altını çizelim. Kitli enjektör kullanmak lazım.
And I prefer you for when they injected an lower lock syringe. So I injected the other part. Change my injector now. And this is the standard mesotherapy injection, and 30 ml, you know. And let's start the inject now. We clean the area before. We treat here. We go to the maximum for maybe 5 millimeters, if you ask it. This area is special for me because of the needle. You can repeat this session minimum 3 months. Don't forget, please. But according to me, in my clinical experience, I treat my patients after 6 months.
Part of the body before 6 months.
Yes. You can change the sources you talked before. For example, adipose tissue. And for example, bone marrow, maybe. Maybe placental cord, as you know, alloblast, maybe exosome, like this. We will see the healing process step by step, but I prefer you in your clinic, and almost you must support these treatments with supplementers. Don't forget, please. Digestive drugs, for example, vitamins, biotin, and with it needs maybe mesotherapy. I treat, first of all, PMP, point and point, as you know, as the classic mesotherapy technique, and also education in Turkey and the government and mesotherapy. I teach my doctors because, with the mesotherapy also, and now I changed it and nappage, as you know, and the other technique. Yes, it's finished. Okay? You're welcome. Have any question about this presentation, about a theoretical or practical experience? Yes.
Face, if you want to do for face visualizations.
Like this.
Then a patch technique or
The like technique, but you must be sure that you must take the punches post-auricular side, not the hair side. It's first difference. maybe adipose tissue. I usually prefer adipose tissue for anti-aging regeneration. And also I combine it with bone marrow. It's very important according to me because I'm internal medicine. I told you before. So you can be sure that I'm assured that this result is real. But you can need second session sometimes. Don't forget. Yes, I'm proud of meeting you. I'm glad to be talking with you, to be with you here. And thanks for attention.